So you mentioned the CT, and then you mentioned that there are one with dye and one calcium score that you mentioned. Do you mind telling me like the types of the imaging that we commonly use, and I mean, how does it work? Like, so, I mean, how do you use it to assess the heart blockage, and how do they differ in terms of their predictability, their accuracy, and most importantly, what happens afterwards?
Thank you. So, as we want to strive for the better for our patients, so as I mentioned, that one of the technique is just do a CT scan or do a CT angiography. You know, when I take someone into the cath lab, we have a lot of techniques inside the cath lab, the imaging techniques, where I can see the artery from inside. So as you mentioned, that we don't want the road to get messed up or blocked. An artery is just like a tire. It has 3 layers in it. So if I take someone into the cath lab, we have techniques inside where we can use a camera-based imaging techniques. And I'll give you a couple of names. That one is called IVUS. It's an intravascular ultrasound that we use inside the coronaries. Another technique is called OCT, optimal coherence tomography. Just like the way people do it for the eyes, you know, to look into the fundus, we can go inside the arteries and take the pictures. Think about this, that we used to use old gadgets and old phones. In 2025, you have new branded gadgets. Why don't you want your patients to have the precision medicine and exact? These imaging techniques can tell you, I can plan what will be the outcome of the procedure beforehand. So these sound-based or a light-based techniques can help us decide what sort of stents I need. I can plan beforehand and look into and see whether there is a lipid in the artery, there is a calcium in the artery, or there is a fibrous. And depending on that, I will decide my tools and techniques, and I will give an appropriate size of the stent. I will give the best possible length, and I can look into possible complications during or after the procedure. So in Emirates Hospital, as I said to you, that because of my training, we are a very high volume imaging center. So what we do is we do the imaging before the procedure, and during the procedure as well, we have tools and techniques to give the best possible outcome for our patients at Emirates Hospital Group.